Is the foam roller, okay? Does it increase or decrease the tension in the tissues? Can it improve range of motion? Does it release the fascia? Everything that trainers and coaches or, basic gym goers do. Okay, so we're going to debunk the myth of what the foam roller does. Before we tell you what it can't do, let's say what it can do. Okay, so first, a little bit of physiology. Okay, the blood capillaries, okay, are lined with endothelial cells, okay, single endothelial cells, very, very thin, and between those endothelial cells are gaps, okay, and outside of those gaps are the cells, okay, the tissue cells, and the hydrostatic pressure pushes the blood full of sustenance, okay, and goodness, through those gaps, and it bathes and nourishes the cells, okay. Amongst that, some plasma proteins get released into those tissue spaces, and it's the job of the lymphatic system, okay, to mop all that up, including the waste that's produced from cellular respiration, and also any infections that may occur within the tissues, okay. So it's its job to mop it up. Now, why doesn't it just go back into the capillary network? Okay, the reason is the molecules are very, very large from waste, okay? And where the endothelial cells are lined up next to each other with gaps, the lymphatic system, okay, that has basically, they're overlapped and they're flappy basically, and what they do is they open up and they also act as a valve to stop anything getting out. So this allows bigger molecules to enter the lymphatic system. Now, the lymph doesn't have a heart, okay, so it can't pump the lymph, the fluid back up to where it needs to be dumped. Okay, it requires what's known as peristalsis. Peristalsis is basically the squeezing of muscles and the pumping of the arteries around these lymphatic ducts and networks. Okay, help push it up. Now, if any of you have watched David Attenborough, imagine David Attenborough is giving you a commentary of a snake eating an egg, okay? Can you imagine the egg going down a snake hole? That's sort of how the lymphatic system works, okay? So it requires that movement. And it does this on a daily basis. This is why it's important to move, okay? And what happens if we don't get rid of all this waste? It can denature the cells, it can cause disease, okay? It can basically just bring the system down. So, the foam roller basically rolling up the peripherals, okay, so from the ankle up to the hip, or from the hand up to the shoulder, for example, in that direction towards the heart, can help drain the lymphatic system. It's what's known as lymphatic drainage, okay. So that's what it can do. What it can't do is change the tissues. What it can't do is improve force production and all this type of crap, okay. So if you are deadlifting, let's say 150 kilos, do you honestly think, okay, if your muscles can take 150 kilos of tension, okay, do you honestly think, okay, putting your body weight on a foam roller and rolling the tissues is going to improve the length of your tissues? Absolutely not. Come on, please. Do you honestly think that the collagen and elastin is going to be lengthened, okay, around the joints, and you can bench press 150 kilos, 200 kilos, and you think that applying body weight and rolling through the foam roll is going to improve, the length of these tendons or ligaments? Absolutely not, okay? And there was tests done on this many years ago, and it was more to do with massage. And basically what was said was we were trying to look at, can manual therapy actually change the length of tissues? Okay, and manual therapy had no implementation on the length of tissues, okay? The amount of force required was around about 10 tons, and if that was applied to a patient or a client or yourself, you'd fucking kill yourself, yeah? But what it did do, it was invigorating to the nervous system, and if done correctly, okay, the nervous system would relax, okay? It would let the tissues go. Okay, so it can't change the length of tissues, okay, nor around the joints, okay? It can't improve the joint capsule. But what it can do is drain the lymphatic system. Now, myofascial release is a big one with foam rolling. Can it improve the fascia? Well, there was a study done recently, and it looked at muscle force, rate of force development, and muscle activation, okay? And it didn't improve any of these, but what it did do was improve range of motion. And what we're going to go back to is the nervous system. Now let's listen. Bone, unless it's a pathology or a deformity, goes where muscle places it. And muscle, unless it's a pathology or a deformity, goes where the nervous system places it. So everything has to do with the nervous system. Now, if you're trying to change the length of a tissue and you put a massive amount of pressure on the foam roller and run that up the length of your limb, okay, the nervous system is going to react in a negative way. But if you're helping drain the lymphatic system nice and gently, at the same time you're going to innervate the nervous system, and what this will do is this will relax the tissues, allowing for greater range of movement, okay, and that's what the study proved. So stop listening to the crap, okay, that foam rolling lengthens tissues and it's good for injuries and all this bull, okay. All it's good for is lymphatic drainage, okay, and all it's good for is innervating the nervous system if done lightly and correctly. Okay, guys, if you've got any more questions, and I know a lot of people out there use the foam roller and they've been, brainwashed into thinking that it improves the length of tissues and it can, it can paste out all that fascial release, okay? There's lots and lots and lots of studies that have been done that prove otherwise, okay? But it is fantastic for lymphatic drainage, and lymphatic drainage is important, okay? If we don't get rid of that waste, we can not only just get new sustenance to the tissues and bathe those tissues in new sustenance, okay, but we can't get rid of that waste, and this can denature the cells. But most importantly, if an infection occurs, okay, it can't get rid of that infection, and that's one of the most vital ones. And also plasma proteins as well, very quickly, are very large molecules, okay? And if the lymphatic system isn't working well, and those plasma proteins stay within the interstitial spaces, okay, bathing the cells, they do what's known as they have a high osmotic potential, so they will drag water into those interstitial spaces, and what will happen is you'll get edema and swelling. So if your lymphatic system is really weak, okay, you will get edema. You will just swell all the time, okay? And this can be one of the problems.